So today we will be talking about injection dobutamine. Now you must know that injection dobutamine is one of the inotropic agent that increases the contractility of the heart, and it is purely an ICU drug or an emergency drug or the drug which is for critical cases. Now we must know that this dobutamine is always for short term use. So we'll come to that later as well. Now, this dobutamine is specially for the decreased contractility of the heart due to heart failure. Now, it is purely for heart failure, and this is very much commonly used drug for cardiac surgical procedures as well. So this is indicated for two main reasons. First one is heart failure, where there is decreased contractility of the heart, and second is for cardiac surgery, especially post CABG or post cardiac surgeries. Now, it is purely for the hemodynamic improvement, and actually, it does not improve mortality of the patient at all. So, it is simply a temporary fix for blood pressure as well as circulation. Blood pressure means for hemodynamic improvement, and circulation means to increase the cardiac output so that other systems like kidney, heart, brain, and other system can be sustained for few hours, few days till the definitive treatment could be done. And this definitive treatment is either revascularization, stenting, or bypass, or the mechanical circulatory support like intra-aortic balloon pump therapy for heart failure, and or the heart transplant, which is the definitive treatment for heart failure. Now, this is used for mostly patients after MI, or for those patients who are known case of reduced ejection fraction and with signs or symptoms of decompensation, where there is low blood pressure, there is low cardiac output, where there is reduced urine output, which is sign of or a reduced cardiac output, reduced blood pressure, or reduced contractility of the heart. Now, it is basically inotropic, so it increases the contractility of the heart, as well as it has some chronotropic effect as well, so it increases the heart rate as well. And this depends much on the dose. Whatever dose we are implementing, on that only these inotropic and chronotropic effects are seen. We must know that dobutamine has selective beta 1 agonism, so it only and only acts on beta 1 receptors only. So this beta 1 agonism is responsible for increasing contractility, increasing stroke volume, and increasing cardiac output. As soon as there is cardiac output improvement, these baroreceptors are activated because there is increase in cardiac output, so there is increase in blood volume that is pushed, and this excess of blood volume is sensed by the carotid sinus, so then it reduces the systemic vascular resistance. So what is the dosage? The dosage is zero point 0.5 to 1 microgram per kg per minute, and maximum which we can give is 40 microgram per kg per minute. But this much of dose is very hardly used. We must know that as we do TMT, that is treadmill test, where we ask the patient to run, walk, and we achieve the target heart rate. What is the target heart rate? It is always 220 minus age. So if age is 40, the target heart rate is around 180. So we ask the patient to do physical activity till his heart rate is achieved, and we see ECG changes, or we see whether the patient develops any symptoms or not. So if the patient has osteoarthritis, or if the patient has joint disorder, if the patient is very much obese, in such instances patient cannot walk, patient cannot run. In that instances, we can do the stress echo test, where we start or we give injection dobutamine at the dosage of 5 microgram per kg per minute, and we increase the dosage to 10 microgram per kg per minute, and we do these increments every 3 to 5 minutes till our target heart rate is achieved, and then we can conclude that that stress echo is done, and we can report it whether it is positive or negative. So in short, injection dobutamine is one of the excellent drug with very good or very minimum usability, and it is only usable for the hospitalized patients with severe systolic dysfunction, with low blood pressure, and with significantly reduced cardiac output, especially because of the reduced cardiac contractility. And the target is to preserve the systolic blood flow and protect the end organ damage till the definitive treatment or definitive options are done, like see IBP or bypass or revascularization. So this is all about dobutamine. Thank you.